All right, man. So super happy we're able to do this. You got
Yeah.
2 weeks left here before you head
I
back.
know. Second week of July, then I'm done.
So you're here through 4th of July.
Yeah, I'm here past.
Here past 4th of July. I remember when Prashant left, I felt like, man, that was so sudden. We had such an abbreviated time together. But when I started PGY2, he was already starting his second year of fellowship.
Right.
But you, I've been with for the entire experience.
Yeah, the whole 2 years.
Whole 2 years. And it's really been awesome to see you dominate the Retina Fellowship. It's been great, like getting to know you both as a friend and having you as a teacher. And I was to be honest, I was a little bummed when we were talking like 6 to 8 months ago, and I was asking in terms of jobs what you were looking at, and you were talking about potentially going back to Puerto Rico.
Going back home. Yeah.
And I was like, man, I just, like when I think of you, like I know you're from the PR, but I just assumed it was like a one-way journey.
Right.
You were going to find a practice here.
And that I was here to stay.
Yeah, because honestly, like if one day, if I ever opened up my own eye institute and had like a multi-specialty practice, you would probably be one of the first people I would call to to help establish or head up the retina department.
Well, I appreciate that. So, that means a lot. And honestly, I thought it was going to be a one-way journey too. It's not that I didn't have plans to go back, but I was keeping a very open mind about it. And I was leaning more towards staying in the States. But the longer I was here, the more I missed home. And not necessarily because I was having a bad experience here. Quite the opposite, actually. It's been a phenomenal 6 years for me and for my family. But we just missed home. And all of our friends who were in similar stages of their careers in life started going back as well. So that pulls you, and family, it drags you back.
Your family's always been there.
Most of my family's back there, and my wife's family's back there too. So we just, we always felt this pull.
So it wasn't like when you left initially, it wasn't like you always knew you were going to come back. It was kind of up in the air.
Well, not that I always knew I was going to come back. I kept an open mind about it, but I actually thought I was going to end up staying. Once I matched into ophthalmology here in the States, I thought I wasn't going to come back. But life is full of surprises.
Life is full of surprises. And you technically graduated 2 weeks ago. You have 2 weeks left here before you're officially in attending.
Correct.
You're in limbo right now.
It's a little bit of a limbo.
What's it like when you look at starting to practice? So you feel like you're ready to become an attending?
I can't wait to start. I'm not sure about how ready I feel or not. I just know I can't wait to start. And it's an emotional roller coaster. Some days you feel like you're ready to tackle the world and you feel really confident. But retina is also a very humbling subspecialty. And other days you just feel like things aren't going your way and you sort of start doubting yourself. And it's like, well, am I ready to start? Can I start? And then you talk to your superiors and you see how they also struggle. And it's just a matter of how you approach life and how you tackle the problems that come to you. Because there'll be problems that you don't know how to handle and you're just going to have to figure it out. And not necessarily medically speaking, but just in terms of logistics and stuff like that. And just in your career in general. So I'm excited to start. And I think I got a phenomenal training here and at Georgetown as a resident. So I'm eager to go back and just start.
That's a great attitude, man. I remember when I spoke to Steve and Prashant before they left, they both kind of expressed similar sentiments, which was they were a little nervous, but they also felt incredibly ready. And they said at this point, you kind of just have to do it, just jump into it head first and just get started.
Right.
When I was younger, I traveled a lot more than I do now, obviously, it just being in the medical profession. Right. But my family's in India. And so when I was younger, every other summer, I think we would spend like 3 months over there. So I'm pretty used to traveling a lot and spending extended periods of time away from home, but I've never permanently moved away somewhere. We were just talking about what it's going to be like moving your car to the PR. I mean, I imagine the past 3 months, 4 months for you have been incredibly hectic. The logistics of it. What's that been like?
Super hectic. Well, it's an interesting point you brought up because we actually had an apartment rented since April that we had been paying. And the owner of the apartment, unfortunately, lost his job with coronavirus. So 2 weeks before I was about to bring my family back home, he calls us and says like, hey, I need the apartment for my family and myself because, well, I have nowhere else to be. So we had to start looking for places 2 weeks before I was going to take my wife back home.
This is back in PR.
Back in PR. Yeah. And it was just super scary, an emotional roller coaster. But we found a place and we're really happy about it. It's in terms of adding to that hecticness. We initially were going to take all of our stuff back, but then the place we found was fully furnished, so we ended up selling most of our stuff. So we've been super busy meeting with people after work, like parking lots at 7 p.m. or 8 p.m. that I met through Facebook Marketplace and just selling everything we own.
Right.
Yeah.
Now, where are you going to be? Where's your apartment in the PR relative to where your family is or her family is?
It's in the same town, actually. I'm going to be probably, 5-6 minutes from both my parents and my in-laws.
And how close is that to where you're actually going to be practicing?
So I'll be in a couple locations. The main office is about 20 minutes away, and then we cover a good amount of the island. So I'll be driving a good amount.
I remember you telling me you're joining us currently a solo practitioner, right?
So there are two retina specialists in the group, but one's medical retina, and then the founder's surgical retina. So I'll be the second surgical retina.
Gotcha.
Yeah.
And are you guys? Yeah, it sounds like you said you're covering a lot of the island. Are you pretty much the only retina group in town, or are there other sort of?
No, absolutely not. Actually, there's a good amount of retina doctors. By my last count, there were about 30 retina doctors, and out of those 30, probably 21 were surgical retina. The rest were medical retina. So it's a good amount for the amount of people that live there. I think when you're looking for jobs and just figuring out which city you want to live in, what's considered saturated is one surgical retina per 150,000 in terms of population. And if you take 30 and divide it by 2.8 million that currently live there, it's a lot less than 150,000. So it's actually, it's somewhat saturated. There's still lots of work and a lot of people need care, but it's not, there's a good amount of retina doctors there.
That's interesting. I'm just so used to at least hair. It just feels like there's a never-ending list of people who need retina care.
Right.
Like there's just the issues with the diabetes, hypertension, whatever. It almost just seems like there's too much work for even the amount of specialists we have in our area. At least in Ohio, it's a lot too.
Yeah, it is. It is.
What has the credentialing process been like? Because I know Puerto Rico is it's considered part of the U.S. territory-wise, so it's not like you're moving, to Europe or something.
Right.
But
so it's essentially like moving from one state to another. You need to get a state license, and then you need to comply with whatever regulations they have in terms of like a state level. So if you were moving from Ohio to California, then you would need a California medical license, and then if there's DEA, you would need your DEA there and other minutia. So it really wasn't that big of a hassle. It's the same thing. And even coming from med school, like our medical school is LCME accredited. So we're not considered foreign medical graduates.
Right. You're not IMG.
We're not. Right. So when we apply as US graduates. It's actually a pretty similar and, sort of smooth process altogether.
I was going to ask this before you said how many retina specialists there are, but when you go back, are you going to have a period of time where you kind of have to meet and greet with the referring doctors, or do you feel like you kind of know the ophthalmic community pretty well there?
So I did my residency here. So I didn't spend those 4 years back in PR, just sort of meeting the people. So I think I should, go out and meet the people regardless. I think it's a good idea for anyone just starting a practice, because you're never going to know everyone.
Right.
And there's nothing like a face-to-face. So I'll definitely be, going out and meeting not just referring doctors, but ophthalmologists and in general in the community, other retina specialists. I want to take part in, retina journal clubs and dinners with the residents, like lecture dinners with the residents. And then just helps keep yourself up to date and just familiarize yourself with the community.
When you were in medical school there, did you rotate with this group you're joining?
So no, the group I'm joining is not connected to the residency program. So I did not rotate. And I also didn't do a rotation back home when I was there, because my wife wanted to do a dental subspecialty that she couldn't do back home. So, and I didn't want to be away from her. So I decided that, well, I'm just gonna go all in on trying to find a residency in the States. So I did 3 away rotations, and the way it worked out with the schedule, I just didn't have time to do a rotation back home which I really would have loved to do. But it just didn't work out that way.
So when you were in medical school there, she did dental school there.
Correct.
Okay.
In the same institution.
So you guys met before that as well, back in like
undergrad?
Yeah,
we met a long time ago. We were actually next door neighbors since 7th grade. So we went to the junior prom together. Then we sort of each went our own way. And then we ended up in the same undergrad. I first started as a computer engineering major and I did not like it. I figured out I wanted to do medicine. So I switched to biology and she was there. We started taking classes together and I guess one thing led to another.
That's like junior high, not even like high school sweethearts. We have the phrase like junior high school free sweethearts.
Yeah, I mean, sort of, because we weren't really into each other at that time. But yeah, we knew each other since then.
Nice. So she's already back there. The kids are already back there.
Yes.
In terms of when you both start up, like when you move back in 2 weeks, are you going to start practicing pretty soon or will you have like a little vacation period?
I have like three and a half weeks.
Okay.
Now my starting day will be August 3rd.
And she's going to be practicing as well.
Correct.
Out there.
Yep.
And how old are your kids right now?
They'll be 2 in August.
Okay. I guess it's good. You'll have family nearby, both of the families to help raise the kids. That's nice. That's convenient. In terms of when you look at everything you've learned experience-wise in ophthalmology and residency here and fellowship here, you've very much seen both the academic and private practice side of things. What are sort of the biggest changes or adjustments you think you're going to have to make when it comes to practicing retina or ophthalmology back home in PR?
I mean, there's not going to be much changes because the way medicine is practiced is essentially identical to here. So I don't foresee much changes other than, there's many ways to skin a cat and there's many ways to fix a retinal detachment and many ways to fix a diabetic retinal detachment. So I've had the opportunity to see many experienced surgeons at work and I've kind of sort of picked what I like about each and what works with what I'm good at and what I'm not so good at. And I just I've kind of developed my own sort of mix of way of doing things. And in a sense, that's kind of what I'll change. I'll just have my own little way of doing things, but it's all a mix of how other people do it.
Right. I feel like talking about you going back there, I feel like I've met you in such a narrow window of your life. Just like I'm experiencing a little slice of Ferdinand's life there. Prior to coming to the States, when you were in the PR, what was that? What's life? I've never been there. I've been to El Salvador. We just did the mission trip there. Next year is going to be Honduras, but I've never been to Puerto Rico. What is life like there growing up as a young kid there? Yeah,
I mean, it's a very interesting mix of having U.S. influence and then considering ourselves Latinos. And so, it's kind of like a hybrid between a Latino country and just being in the States. It definitely doesn't feel like you're in a U.S. state, but it also doesn't feel like you're far from it. In terms of the culture, again, a mix. So, there's most of the schools are bilingual. You have a lot of the American culture, like your typical fast food restaurants and stuff like that. But, there's a lot of Latin flair to everything. And there's this uniqueness that's developed by mixing everything that is what Puerto Rico is today.
Your family, are any of them physicians?
My brother is a med peds. He's finishing now. He'll do a chief resident year, and then he's applying to pulmonary crit care. And then on my wife's side, her dad's a dentist, and a lot of her family is a dentist, and one of my uncles is a dentist.
Okay, so a lot of people in the medical sphere.
Yep. And my cousin's doing ophthalmology residency in Georgetown. Right?
Oh, nice! Look at you, trailblazer, paving the way for him. The brother you have, older or younger?
Younger.
And he's doing his training back in PR, or he's over here in the States?
He's doing his training back in PR.
Okay, so you weren't the first in the family. Oh no, you said younger.
Younger.
So you are technically the first in the family to become a physician.
I guess so. Yeah.
Yeah. Okay. Very cool. When you were doing medical school there in the PR, when did you realize you wanted to come to the U.S.? Was that much later in training?
It was when my wife there were two sort of, this answer has like sort of two pathways, I guess. So there's my wife's pathway, and that is that when she decided she wanted to do periodontics, there was no way for her to do it at home. So that kind of switched. And then when I initially wanted to do orthopedic surgery when I started med school, and then I just realized that wasn't the thing for me. I wanted something that had more of a diagnostic puzzle in like the day-to-day clinics. So because that's what I liked about medicine, I liked the puzzle that was, diagnosing something obscure or cool. But I also like the surgery part. So I felt like ophthalmology gave me a little bit of both. So when I decided I wanted to do ophthalmology, I started to look at places in the U.S. because my wife, well, she didn't have any other option.
Right.
And so I guess sort of beginning of third year is when I realized I was probably, or that I was going to sort of put all my eggs in one basket to try and come to the U.S. I'd say beginning of third year, probably about right.
Were there a lot of people in your medical school class who were thinking about doing that? Even
Yeah.
people who weren't applying to opt though?
Yeah, maybe not necessarily saying like, let's put all our eggs in one basket and try to match somewhere in the US. But they were applying broadly, and our class did really well in terms of step one and their overall grades. So I mean, most of my classmates were really, really solid applicants. And a good number, I can't tell you a percentage, I don't know it, but a good number of them ended up matching at really good residencies, regardless of specialty. So yeah, I'd say a fair number, but also a good amount stay back home and they do really well.
You talk about putting all your eggs in one basket. Ophthalmology, in terms of matching into a medical or surgical specialty, is very competitive as it is. And yeah, the Puerto Rico is not considered another country,
Right.
but I'm imagining it's got to still be quite a bit of a challenge. How did you strategize your approach to putting your eggs in all in one basket?
Yeah, it is. It's definitely challenging, and more challenging than if I were to come from the top 40 ranked U.S. med schools. So the first thing I did is I looked at someone else who had done it in the past, and then I called that person, and he sort of said what he did. The thing he recommended the most was you need to get to know someone who's respected by a lot of people in the community, in the U.S. ophthalmology community, and have that person write you a recommendation letter. And that's kind of your way of saying, hey, I'm being vetted by someone who you may know.
Right.
So that sort of balanced the scales, so to speak. So I tried to do a ways. I did one away at Mount Sinai in New York, another New York guy here, and another one at UIC, University of Illinois, Chicago. And that was my first one.
But why specifically those? Is that just kind of how the aways ended up working out, or was there specific people or connections from the PR that were pre-existing?
Correct. So the UIC connection was because of the person I talked to initially that recommended this doctor there, Dr. Jose de la Cruz. He's Puerto Rican, and he's one of the associate professors at UIC. He's one of the Cornea Fellowship cert mentors as well. So I did a rotation with him based on the prior person's recommendation, and it was phenomenal. It just cemented that in me that I definitely did the right choice of doing ophthalmology. So I got 2 of my recommendation letters from there, and then 1 recommendation from a cardiologist back home. And then after that, I did the New York aways because my wife wanted to be in New York. So I figured, well, let's just see if I like the programs there. I know New York is sort of its own beast, and things work very differently there. So I just wanted to see sort of firsthand what it was like.
The whole spectrum between orthopedic surgery and ophthalmology is quite vast.
It is.
What got you from one end to the other?
They're actually, they're at opposite ends of the spectrum.
Right.
Yeah. So, one of my best friends wanted to do orthopedic surgery since he was like, had use of reason. And when I went into medicine, he was sort of the person that I talked to the most. And it seemed pretty appealing. It's like, the guys, right. Sort of specialty. And the surgeries itself looked really interesting to me. But once I got more into, like I said, the medicine itself and the diagnostic puzzle, it just felt less and less appealing. And I was doing my general surgery rotation in third year, and we were watching like the 100th appendectomy, and I was like, oh boy, I got to get out of this room for a sec. And I just sort of peeked into the next room, and it happened to be ophthalmology. and they were doing a retina surgery. And I didn't know what I was looking at. I had no idea what they were trying to do or accomplish. But I was like, oh, this is pretty interesting. Let me sort of just read a little bit more about this. So I talked to the resident that day. He sort of described the procedure, what they had done, and just sort of what to look up so that I could read more. I started reading about it. Then I called him up, and it turns out he went to my same high school, just a couple of years ahead of me. So I kept talking to him for a little bit, and I followed him and other surgeries. And then I just followed him in clinic, just kind of informally, like when he was, like after my med school classes, he was still after hours in clinic, and I just kind of went there, shadow for a little bit. And then I decided that I needed to commit to one specialty or the other. So I decided ophthalmology.
Hmm. So you were kind of imprinted with retina from the very beginning.
Indirectly, yes, but I did not know I wanted to do retina until I actually started my residency.
What did you do besides, doing these aways and getting letters of recommendation from these essentially well-known ophthalmologists in the community? Was there anything else you did in terms of networking or in terms of having people pick up the phone to make calls for you to improve your chances of matching?
Right. Well, I had the faculty at UAC call up some programs and talk me up basically. But other than that, just solidifying your resume and making sure that there wasn't anything there that would make you any less of an applicant compared to other people. Just, good grades, try to have the best scores that you could. And obviously research is huge in ophthalmology. So
when you applied to residency, you ranked all the US programs you interviewed at. Did you also rank PR programs in that same list?
I did not, because if you don't do a rotation there, they don't.
Oh, okay. Even though if you're from there.
Well, yes, but I didn't apply there basically because I knew I didn't want to waste their time. I didn't want to waste my time and money, and I knew I wasn't going to end up there. So whenever I'm encountered with like these sort of dilemmas, I think of the worst case scenario, and I said, well, let's say, what's my worst case scenario? I applied to the US and I don't match, and do I just wait another year, or would I rather try and match in PR, which is also not a sure thing because it's actually really competitive as well. There were a lot of people applying that year, and there's people that didn't match the year prior that were also applying and had tons of research. So it's not like that was a sure thing by any means. So I said, you know what? Worst case scenario, I don't want to be away from my wife. So I'm just going to do something for another year and then reapply to the US. And luckily that wasn't an issue, but so I did not apply to PR.
So you guys were married by that point?
We got married. Yeah, we were going to get married like at the end of med school. We got married June 14th.
Okay.
End of med school.
Oh, so pretty recently.
Yeah.
Anniversary wise.
Yep.
I don't know what it was like for you for match day in medical school back in PR, but here in Cincinnati, we have a sort of a controversial, unique way of doing our match day. There's a lot of medical schools across the nation where everyone just opens up their envelope at the same time. Here, what we do is we get everyone in one room, and this is an opt-out process. No one's forced to do this. You get to pick sort of a walk-down song in advance. And so we're in one of these large lecture halls, and we have two of our sort of medical school educators at the front who have sort of a jar or a box with everyone's name on it. And they just randomly pull people's names out.
Okay.
And when you get called, you sort of do the slow walk up to the front to your song. And then in front of everyone, either with your significant other or by yourself or, a family member, you announce to everyone where you're matching.
Wow.
So it's like a very on the spot, stressful situation. But that is the one day in the medical school here where I feel like the positive energy, the happiness, it's electrifying. It's palpable in the air. It's the only day here where there's just so much goodwill. And even if you're 200 feet away, you just feel it and then you just get put into a good mood. Right. What was it like for you putting all your eggs in one basket? Your wife is also applying. What was that like on match day? Finding out that
it was phenomenal. Yeah. We don't do the stuff you guys do here. Plus, because ophthalmology is a separate match, right? We find out a couple months before them. But it was extremely exciting. When I found out I was going to Georgetown, I couldn't believe it. I was stoked, and my wife was super stoked as well. So it really did work out.
So so we find out in January, right? In the ophthalmology match where we're going. So you're going to Georgetown. There's still the question of where are you going for your intern year, up in the air for about another 2 months or so. How did your wife sort of adjust her plans based off you finding out you were going to Georgetown?
So we adjusted beforehand because I still had to apply to places. So we said, no matter what, we're gonna only apply to New York programs for internship, and then depending on where I match, you'll apply for your residency, because her residency is 3 years, but she would apply the year before as opposed to 2 years before like we do because of intern year.
Sure.
She would be able to apply while we were both doing intern year, right? And she did not have to do that. She sort of did it because of me, to just kind of figure out where I was going to end up.
Right.
So I only applied to New York programs. I interviewed in like 5 or 6 places, and then we ended up matching where we wanted. There, she was at Maine Mount Sinai. I was at Mount Sinai, St. Luke's Roosevelt. And while we were there, she then applied to periodontics in the DMV, DC, Maryland, Virginia area. And I ended up matching at University of Maryland, Baltimore.
So prior to you guys coming over to New York and you starting intern year, you said you'd done 3 OAs. You'd also done some cardiology research. Was that as well in the U.S.?
Yes, I did cardiology research back in my first summer of med school at UT Southwestern in Dallas.
How does that align with orthopedic surgery or ophthalmology? Or is that just kind of just to get exposure?
I'll be totally honest. I had nothing on my resume, and I wanted a paid internship for that summer. And that was the only one I was accepted that would pay.
I did that first summer doing pediatric pulmonology, so I kind of understand the same thing.
Right.
But
and it was a great experience, honestly. I considered cardiology for a bit, but it was a very short time.
yeah, it's hard. I mean, you can have a productive summer, I think, between the first summer between first and second year of med school, which is when a lot of people find out what they want to do. For me, I took away just a lot, just learning about big research. I mean, we had a lot of departments co-managing the work we were doing, so that was a good experience. But I think for me, at least, that was kind of the first inkling that I didn't really want to go into primary care, despite some pre-existing interests from high school. And the reason I even got into medical school was because I was interested in neurology.
Okay.
And so for me, the first 2 years, especially that summer, we were just kind of realizing everything I thought I wanted to do was not actually how things were going to end up. So you'd done 3 months in the US, you'd done that summer. So maybe you've almost done half a year in the US. And now you're transitioning over. You've had a taste of the American culture. Had your wife ever been over here before that?
Yeah, we visited a lot of times. And honestly, we're very familiar with the American culture, like just before doing the OAs. It's nothing like living here, but yeah, it wasn't that big of a cultural shock, if at all.
So you didn't really have to acclimate or adjust
Not
at all
really,
to it?
No.
We were just discussing, I think, what was it on Thursday at Hawksworth, how much you enjoyed your intern year. Like it was a great year for you.
It was a really good year.
And now it's June and end of June, and we're in the face of this COVID-19 pandemic, and it's like New York is almost unrecognizable.
It is. It's so sad what's happening there.
I'm sure you've made a lot of friends during your intern year there who are probably still there, and we have colleagues who've either gone there to train or moved back from there. Your friends who are still there, what have they sort of thought about everything that's going on?
I mean, it's obviously nerve-wracking, and they're right there in the middle of the hotspot. They were just scared. And some of my retina colleagues, they were like, we just don't want to be put in a spot where we have to choose between saving someone's eyesight and, saving someone's lives. Because if we get pulled out of our clinics and we can't see retina patients, a lot of these patients are going to go blind. They can't wait more than 4 weeks for treatment. So luckily, my closest friends that are doing retina in New York, none of them got pulled to do just COVID wards, so to speak, or ER. But there was the threat, if you want to call it, of being pulled to take care of these patients, but none of it happened. So
yeah, it's been absolutely remarkable. I mean, I have friends who are in radiology, anesthesiology, dermatology there, and so many of them have been pulled for months to go help out on the wards, and it's one of those things that's scary, but at the same time, it's like awesome to see, physicians coming together and
absolutely.
And that, I don't know what your opinion of that. I want to pick your brain on this, but the concept of having a intern year prior to ophthalmology, whether it's a preliminary year, a transitional year, a lot of ophthalmologists I've spoken to regarding the value of that, a full year potentially of medicine, are kind of split 50-50. Some say, you know what, like I don't remember anything from that year. None of that's really carried over into ophthalmology besides the basics of being efficient or
Mhm.
doing patient care. And then there's some people here, some really high volume surgeons who have said, learning how to manage diabetes or kidney failure was like a really essential experience. Like, absolutely, that should be a part of training.
Yeah.
And now we're in the situation where so many of our friends are being pulled who are not in primary care
Right.
to do that. And it's like, there's clearly value to doing that intern year.
Absolutely.
As someone now who's just finishing Retina fellowship, let's put COVID out of the picture and
Mhm.
pretend that didn't happen. Do you feel like 12 months of medicine is necessary, or do you think some of these transitional years or integrated intern years where you're getting to do more ophthalmology early on is the way to go?
I 100% think that 12 years of medicine is not a waste. I think it was really helpful in my formation as a physician. We did a lot of ICU, and in retina we deal with a lot of patients that are very, very sick. I've had 4 patients either code or about to code in the clinic, and sometimes during the weekend when there's no one else around. So if you don't know how to handle that, patients can die in your chair. So I'm extremely grateful that I did intern year, and that we had 2 medical codes a week in the hospital, and we were running not running, but participating in some of those codes. And then sometimes until a more senior person got there, you were essentially running the code until the code team got there. So I think it's very valuable. I think there's a reason why we all take ACLS and BLS, and it's not a waste. I mean, we're physicians first, we're ophthalmologists second, and then subspecialists third. So I agree. I did not do a transitional year for that same reason.
Really?
I wanted to do full on medicine for a year, and I thought it was going to be helpful for me. And I think I made the right choice. I don't regret it by any means.
That's really interesting to hear. I don't know too many people who purposely chose a preliminary year just for that reason. Uh, I think a lot of people just wanted as much ophthalmology time during intern year as possible, or not, a really strenuous intern
Right.
year where you're just doing tons of ICU, tons of night shifts, tons of medicine. I've heard of some people, you're probably the first actually to ever say that to me. I know I've heard of some people really wanting to do like a surgical preliminary year,
Hmm.
but that's awesome to hear.
Yeah.
Did you, when you were there in New York, did you have any time to work with ophthalmologists at all?
So
Or
not at all. I actually did zero ophthalmology other than read on my own. Probably the last month or so of intern year. So no, it's just purely medicine. I didn't choose a surgical transitional year or preliminary year because I felt like the surgical skills and in general surgery wouldn't really help me a ton in terms of ophthalmic surgery. Now that may or may not be correct, but I felt like the intensive care unit and the medical part of managing complex medical conditions was more essential to my formation as a physician, and that I would get my surgical training from my surgical residency.
right?
So
Yeah, and I'm not sure even how much in those surgical prelim years where you actually get to be in the OR as opposed to just managing floor patients.
correct.
Yeah, although I've heard, I think there was,
It varies. I'm sure there are surgical preliminary years where you're in the OR more than others, and probably some to a good degree.
yeah,
I mean, um, it's not a waste of time either. It's just, in my mind, I thought it made more sense to do a medicine year.
right. I think there's one or two programs I remember when I was applying to residency where they mandated it. They mandated that you had to do a surgical prelim year at their institution,
Interesting.
but they had it as sort of a good gig where they said you wouldn't be, I think, covering surgical call. You would be in the OR. You were going to get to work on some of the more fine motor microsurgical type skills. So
Hmm.
you're right. It's just intern year is so different regardless of where you
Right.
go. And now we're seeing this push probably in the next 2-3 years for all intern years to become integrated.
Right.
Ours here is kind of unique in that we have 5 or 6 months of ophthalmology, and then the rest is pretty intensive pure medicine. But I think they're going to make it so that in the future you can't have more than 3 months, which I think is a nice balance
Cannot have more than 3 months of
of
ophthalmology.
ophthalmology, right?
Okay.
I think the issue, and this is me just, I'm not a ophthalmic medical educator or
Right.
plugged into the circle or anything, but I think the issue is that there are some institutions that don't have the resources to do more than 3 months, or who don't have affiliations with local hospitals. And I think some of those circumstances are for some of the bigger programs, which
Yeah.
which
Right.
is kind of interesting. But I think going forward, almost all incoming ophthalmology residents will have at least 3 months of ophthalmology. And I totally agree with you. I think, we are physicians first. There is definite benefit. It's not wasted time during an intern year. I did a TY year, but a lot of that was medicine.
Hmm.
I spent, I think, 2 months in the ICU, 2 to 4 weeks of nights in the ICU. But I think ophthalmology today is so different and has become so much more advanced than it was 20, 30, 40 years ago.
Absolutely.
Like you look at the stack of BCSE books from the 70s or 80s, and they're quite thin. And now, the stack is just getting bigger and bigger as we're learning more about the eye. There's more and more to learn. I almost feel like 3 years is not enough. Now, obviously, we're lifelong learners. We're going to continue to grow and learn as we get into practice. But I almost feel like that exposure is worthwhile. But I would never say it's at the expense of an entire year of medical training.
I think a 9 to 12, 9 out of 12 month balance seems reasonable. I wouldn't argue that 3 more months in a 36-month training span would make a huge difference, particularly when it's at a time where you don't know anything about ophthalmology.
Yeah.
But different people can have different opinions about that. And, it's
I think it just comes down to what kind of person is that resident, because you can do 3 to 6 months of ophthalmology during intern year and kind of just, it's kind of like a vacation, not really learn anything. But I think if you are diligent and focused and you say, okay, I want to get better at using the 90 diopter lens at this lamp. I want to get better at just visualizing the fundus with a 20 diopter. I want to become consistent with my applanation, or I have this research interest and I want to work with mentor X, Y, and Z. I think it can be a really productive time, because now that I'm about to enter my chief year of ophthalmology, I've seen what 2 classes of interns look like who've had an integrated experience. And there's a night and day difference in terms of when they're on buddy call with us, in terms of examining the patient in the OR. They're just a few months ahead of schedule in terms of learning those skills. And so I think if you take it seriously, there's really a lot of benefit there. But again, you can just blow it off like it. I mean, it's like anything else.
It's like anything.
You got to put in the hard work, you got to want it, and you'll make the most out of it. So you lived in New York, which is almost, in some senses, like a quintessential American experience, right?
Yes.
And then you moved to Washington, D.C., which is also like an experience in and of itself.
I had 2 really great cities to experience mainland U.S.
Yeah.
Couldn't agree.
What was it like moving to D.C. and finally starting ophthalmology?
I mean, it was a very smooth transition. We basically put all of our stuff that we had in a 400 square studio in New York into a U-Haul, and then just drove to DC and moved there. Starting ophthalmology, it was a little bit rough because it's a whole new language, and you read, but you don't internalize stuff until you start seeing it. And, you have all these ideas floating around in your head that you can't really connect them all together until you start seeing patients. And once you start seeing patients, then stuff starts sort of clicking or at least that's what happened to me. It starts sort of clicking in your brain. And then I would read the cornea book, and then I had this idea of what the cornea was. And I would read the retina book, but then none of it was connected. And then all of a sudden, I think 6 weeks or 8 weeks in, stuff started to making a lot of sense. And why one patient who had multiple eye conditions was presenting with a complaint that was attributable to a certain thing, one of the diseases as opposed to all of them or whatever. It just helped you to sort of figure things out. But it takes a little bit for things to start clicking. And every time one of the incoming residents asks me oh, what's your recommendation? I always say, just read vigorously. I promise you things will start clicking. But if you don't read, it's just very hard. And for whatever reason, in ophthalmology, I've noticed that it's very easy for people to just sort of lay back and take the easy road in terms of just cruising through a residency. And I'm not saying that the residency is easy in any way. We work super hard, but it's just because no one else knows about ophthalmology, you can sort of learn bare minimum and not necessarily, give your best. If that makes any sense. So when my cousin started, I was like, the only thing I want from you is just that you read as much as you can, and you sort of become responsible for your own education, even though you're going to get great education at our program. But, you need to put in the hard work.
That's an interesting take, and I think I agree with that 100%, at least in terms of what I've seen so far on my ophthalmic journey. I've often wondered how much of that, going back to intern year, is people who just have like a brutal intern year in terms of just the amount of work, the hours they're putting in. It's like by the time they finally get to that stage of training that they were always hoping would finally
Right.
come, they're starting, they're exhausted, they're sleep deprived, and like you said, the learning curve is so steep.
Super steep.
I was talking with Dr. Augsburg about this. It's a foreign language. You don't know anything about it in advance. You don't know how to use the instruments, the tools.
Right.
We're really not taught any of this in medical school, apart from using the direct ophthalmoscope. And let's be real, how many of us like faked? Yeah, I can see the nerve or the retina.
Right.
So it takes a lot of self motivation, desire to become better at something, to put in the work, and then while you're having that experience where you're essentially, to me, it felt like PGY2 felt like starting med school all over again.
100%.
And I did reading. I tried to read as much as possible intern year. I did 4 months of ophthalmology during intern year. I mean, I tried to really take intern year seriously in terms of getting to a comfortable state of knowing ophthalmology. But it felt like totally starting from scratch. I'm trying to learn the technical aspect of things. And then on top of that, you're taking primary call.
Right.
And if you're at a place like we are here, call can be pretty heavy
It's
sometimes.
busy.
And so, we don't necessarily get the post call day off. You have to be in clinic the next day. And now you're going to pepper on didactics on top of that, or journal clubs or conferences. So much of your week is taken up already. And I can empathize with, people maybe who just want to take a step back and chill a little bit. It's understandable. But I think you're right. I think there is a danger of, I was talking to someone who's out in practice for cornea, and because I'm going to be applying to, anterior segment cornea refractive fellowships. And I was trying to just pick his brain on some topics. And he said, the definition of complex in terms of managing a complex cataract or a complex corneal issue or something, he said, is pretty much what someone didn't experience in their training, whether that was in residency or fellowship. And so to them, that's complex. But to someone who's had that training, or they've seen that before, or they've taken the extra effort to read about it, to do research or talk to people in the field about it, they're much more comfortable with that. And it doesn't seem as complex to them. And I thought that was kind of an interesting take that just sort of reiterates that you have to kind of be in the driver's seat. You have to take ownership of your education. I feel that way about surgery as well.
Yeah.
You have to take ownership of your own, advancing your own surgical training. I'll tell you what, I'm mortified. I'm very, very scared now that I'm about to start my last year, because I feel like I've taken residency very seriously. I've tried to work as hard as I can, but now there's a light at the end of the tunnel. I got 1 year left, and I feel like I still have so many knowledge gaps or connections I'm trying to make. And then on top of that, this is the year where we really start to do a lot of surgery. I'm happy I'm going to be doing a fellowship, and I'll keep up with lifelong learning.
Right.
But to me, it's like now the countdown has started, and so I'm very much trying as much as I can to stay up with doing reading again. And I think a couple people have told me in your last year, you're so focused on learning cataract surgery that a lot of your clinical skills sometimes can fall by the wayside. So low key, I'm trying to actually double down on retina. I'm trying to learn as much about retina as I can, even though I'm going to be in the future working on a separate part of the eye. So I don't really neglect that. When you were at Georgetown during residency, when was it you realized you were going to do retina?
So retina was my first rotation as a resident, and I sort of made my mind right then and there. It was super scary, and because it's kind of back there, obscure, no one else can see it, but it's a window to the nervous system, the brain, the vascular system. It's honestly phenomenal. So I was just swept away. Once I saw the retina, I never looked back, and I always said I didn't even consider other specialties. It didn't cross my mind.
Huh.
Yeah.
I had a similar experience, and then eventually I moved away from that, because I also started at the VI. Did retina.
I could have sworn you were going to do retina, and then you disappointed us.
I know. I feel like such a letdown. All of our retina specialists, they're still talking to me, trying to. Prashant still is like, it's not too late to do it.
Yeah, it's not.
When you were looking then, okay, you made the decision, you're going to apply to retina. Now you have a broad spectrum of fellowship options. You can do it at an academic institution, some prestigious big name place. You can do it at a very high volume private practice. What were some of the things you looked at in terms of making that decision? How did you realize what was a best fit for you and your personality?
So in residency, I learned that it's very important that you get along well with your staff. And I kept hearing that in fellowship, that was even more important because you're one on one a lot, or if not all the time. So I wanted a place that had obviously really good numbers. That's kind of the objective thing that everyone looks at. But I also wanted really high quality staff. And you said, do you pick a really prestigious academic place or do you pick a private practice fellowship? Well, this fellowship kind of offered both. It's considered a hybrid. Within the retina world and ophthalmology world, it's considered very prestigious. And we just had top notch quality faculty. And honestly, I think this is one of the best fellowships in the country. I can't say that every single day I confirm that I made the right choice. I think my sort of initial impression on like the people who interviewed me and their personalities was correct, and I think we clicked very well. My experience here has been phenomenal.
Yeah, our retina team at the Eye Institute is fantastic. I love each and every one of them. They're just so accomplished in their own right, and each of them has slightly different interests. They're great clinicians, surgeons, and they're actually very interested and involved with teaching.
Correct.
And so I think our retina fellowship here is absolutely fantastic. Now we have 8 or 9 retina specialists in our department.
Well, we have 11 actually.
Well, yeah, now that right, so that's happened. So there's more. As a fellow starting, your job is to learn as much as possible. You're working with each of these different surgeons. They have different personalities. They have different surgical preferences in the OR. How do you go about navigating and adapting and trying to absorb as much as you can from everyone?
Well, you just have to write everything down. Everyone does things slightly different. Some people do things very different from the other, and the result is, similar or the same. So that's when you being in the driver's seat and you putting the work to write stuff down after surgery, write how they did the procedure, what kind of needle they used, how did they grab the needle driver to make things more efficient. Initially, you just want to get the steps down, and then you sort of start. Once you go with another attending and then you go back to someone who you liked in the beginning, what you may have liked in the beginning may change as you learn more. Or it may just solidify like your initial impression and be like, oh, this is definitely the way I want to do it. Or maybe I'll take this from this person and this from that person. But it's just putting in the work, writing all the steps down, and then just sort of picking what works best for you and your ability, practicing what you don't do as well, and then watching surgical videos, trying out new techniques. They're really good at just trying out new techniques that are out there. So we get to experience, just basically things as they come into the surgical world.
In terms of reading or developing the knowledge aspect of things, did you have like a curriculum already preset, or did you sort of did you do it as based off what you were seeing in clinic?
So I started off with Ryan's Retina, and then it was more of a, I saw this case. It was really interesting, and I just want to know. Like, I'm a differential oriented person.
Yes, you are.
Superlative. As you can probably know. So every time I look at something, I'm like, okay, so what can this be, right? And then I try to think of as many things as possible. So in retina, I think for all of medicine, of course, but in retina, there's, it's easy to miss stuff because there are a lot of things that look alike, and the differences are very subtle. And there may not even be differences to the human eye, and it's differences in ICG or differences in ultra wide field FA. So you do need to, just read a lot and get your mind in on it. And so every time I saw a case that was interesting, I just tried to look up articles, and same for surgeries, different techniques and why one technique works better than the other and the potential complications. And once you start operating by yourself, the looking up the potential complications part becomes a lot more relevant because no one is there to save you.
Right.
So you obviously, you're kind of forced to read. Otherwise things won't go the way you need them to go.
I'm not sure what other institutions are like, but I feel like in general, universities sometimes are very anti-industry. And we are so blessed that the Cincinnati Eye Institute views industry as a collaborative partner. And so one of the reasons the Eye Institute, besides, the phenomenal ophthalmologists who work there, is so up to date and on the cutting edge of things is because
Right.
we have this great relationship with industry. Doing fellowship here, what have your interactions with an industry been like?
Well, they've been very frequent. They've been phenomenal. I mean, we got to try just peel a membrane. We got to try like 4 or 5 different types of intraocular forceps. For TRDs, we got all these sorts of instruments that they have at other institutions. But it's nice that if we don't have something available, and we ask them and we ask industry to provide it for us, we get it, and we essentially got to try almost everything that's out there in the market, if not all. So yeah, it's been phenomenal collaboration and really good for your training.
Something, and I think of this almost on a daily basis. When I look at my co-residents, so many of them came into residency either married or with kids, or
Hmm.
they just got engaged or just got married, or they just had their first kid. And I'm not married, not planning on being married anytime soon, not planning on having kids anytime soon. But I feel like there's no way I could do residency. Having a family, a significant other, having kids, and having that responsibility. How have you managed to juggle being a family man, having kids? You had kids for the first time, right, in residency,
In fellowship,
in fellowship,
right?
out of all
Yeah.
places in the timeline of training. What's that been like?
Yeah, I mean, it's sort of like the gas kind of expands to fill the room type of situation. I remember my first class in med school. It was biochemistry, and the professor was like, "Well, yeah, the exam is going to consist of 200 PowerPoints," and I was like, "200 PowerPoints? Did she say something wrong? Did she say 200?" And it was in fact 200 PowerPoints, and each of them were like 60 to 150 slides long. And I was like, "There's just I don't think I've ever read so much information, and much less for an exam." And you're just surprised by what the human mind can do, the human brain can do, right? So it's sort of a similar scenario where like the more you're forced to do, the more you actually end up doing without even knowing. Um, to me, it was crucial to have a phenomenal life partner, and my wife just helped out a ton with the kids. And whenever I had surgeries, she would wake up, and if the kids were crying or something, and she would let me sleep so I wouldn't fall asleep during surgery and that sort of stuff. But the reading and the studying, you just have to find slots in your day where it's just where you can fit some self educating and into place. And sometimes it's staying an extra hour after you're done with clinic, or sometimes it's coming in an hour earlier into the office and reading. And obviously, I'm not the only one to do this, and a lot of people have done it in the past. And it's possible. Is it harder? Yes, 100%. Is it doable? Of course.
You rose to the challenge. Since you were here in the U.S. doing residency and fellowship, did your family from the PR ever come to visit you guys or help raise the kids over the past couple of
Right.
years?
So before we had kids, they visited us, a couple of times. When we had kids, they visited us a lot. So essentially every month. So initially, either my mom or my mother-in-law were sort of essentially living with us for like 2 or 3 months at a time. And that helped tremendously because, as you know, I have twins. So it wasn't just leaving my wife with one kid, it was with 2 kids. And if we didn't have someone there to help, it would have been really hard. And on a fellow salary, you can't always hire someone to help out. And I mean, having family come in and help because they weren't around, of course, it made it possible.
Yeah.
Yeah.
So I'm not saying this just because you're right here in front of me, but when I look over the past 2 years, seeing you start fellowship here, getting to work with you as a resident, just seeing the way you conduct yourself, the way you interact with patients, the way you handle challenges, um, it's exemplary. And it's honestly an example I look at for myself to follow when I start fellowship or even as I enter this final year of training. You're at a point now where you've done residency, you've done fellowship, you've worked with plenty of residents. What are some things that you feel like residents can do to either make more of their experience in training or for fellowship? Uh, and what do you think that the residents don't necessarily do a good job of that you feel like they could be taking more advantage of their time in training?
Yeah. Well, this is without answering the last part of that question. Just in general, what you can do, I think empathy and trying to figure out what people actually need is crucial in order for you to get by successfully. Because I realized that most of the time, whenever there's a conflict or an issue with either a patient, a staff, or resident or ancillary staff, it's a problem with communication, and it's a problem with either the resident or the intern or maybe the staff member just not being able to figure out what people were trying to convey, and then the message just gets distorted and taken the wrong way. So if you just sort of sit back and just try to understand why they're angry or what they're trying to say. And it sounds obvious, but it's really not. And with patients, this happens all the time where they come into the office and they're super angry. And it's really easy for you to just be like, why am I getting yelled at? I haven't done anything. And then just not necessarily lose it, but just not go that extra 10% to try and make them feel a little bit better and just diffuse the situation. And it ends up saving time. Patients are happier. You are happier because it's not nice to be angry. I mean, it takes a lot more energy to get angry than to try and diffuse the situation.
Absolutely.
And but not everyone realizes that, and they just get angry, and it ends up taking up much more of their time. So I think just sort of one is empathy, but also just trying to understand what people need at that time and why they're acting that way is something that has helped me my entire life, just to get through tough situations. So that would be something I recommend. But I'm not saying that the residents don't do that. So that's why I specified that.
No. That's what I was talking about. I wasn't even referring to our residents in particular, just kind of in general. But I agree with you 100%. I've had this idea floating around in my head now, or just the sentiment for the past several years, which is so many conflicts in life, so many hardships could just be avoided or prevented if people were just better at communicating. And we take it for granted. Like, oh, I know how no one wants to say they're a bad communicator or that they lack.
And it's also a problem with like sort of insight, right? People don't necessarily think they're bad communicators because how would you sort of know that, right? Unless you have trouble just getting words out, right? But it's tougher to realize than one would think.
Yeah. And when I look at patient interactions or interactions with staff or physicians with patients, just in the medical sphere, and then even outside, just in day-to-day everyday life, when you go to the cafeteria and interact with people you meet there or just down the street, so many things are just reliant on communication. And as human beings, that is at our core.
Right.
And I think, so how would you recommend someone improve their empathy or improve their communication skills? Like, it's not an easy task.
It's not easy. And honestly, I'm not sure how to answer that appropriately. But one thing I would recommend is just taking the time while you're in a difficult situation and sort of take those extra 3, 5, 10 seconds and try to figure out why things are going the way they are, as opposed to the way you expect them or had expected them to go, and just sort of tweak what you're saying or doing. And just that's kind of how I try to approach and diffuse a situation when it presents. And it presents a lot more frequent than you would think.
All the time.
And patients are really anxious, rightfully so, about their eyes. And whenever something does it, and the same way that other doctors in medicine have very poor understanding about the eyes, and I'm not talking everyone, but just in general, patients have even less understanding about what's going on with their eyes. And it's really frustrating and really anxiety inducing because they notice it right away because, well, they can't see. So educating them is very important and just reassuring them. And you tell them something, but when people are anxious, they only listen to half of it, or they're thinking about their anxiety and how they're going to go blind, even if it's true or not. And they don't listen to half of the stuff you said. So even when you tell someone something, sometimes it just needs to be repeated in a different way, or, from a different approach or from a different sort of emphasis or point of view, to get your point across,
Yeah, no, I agree 100%. You can have someone who's the best teacher in the world or the best orator or communicator tell you something 1,000 times, but if that's just not the way you receive information, or it's just not the way it takes for something to click for you, sometimes that's all it takes. Someone else to come in, or a different approach, or taking 10, 15 seconds to take a step back. I like to, a lot of times, just pull up Google and go to Google Images and just pull up pictures of pathology or the eye and show it to patients. Because a lot of times it's very hard for them to understand
Right.
early stage glaucoma if it really hasn't affected their vision too much, or the beginnings of diabetic retinopathy that maybe haven't affected their vision. And,
Right.
and you're trying to explain to them the importance of, whatever, managing their eye pressure or their blood sugars. Yeah, I don't have a good answer to that either, apart from just trying to be diligent and trying to improve. I think a lot of it is also, and when it comes to empathy, is what are your life experiences like? Like, did you grow up always kind of in the same social circle? Did you
Right.
have very life experiences? Have you lived in a different country? Have you been around people who are, upper class, middle class, lower class? I think just the whole breadth of a person plays
Right.
into that. And yeah, I mean, if you don't want to improve or you're not even aware of the issue, it's hard to do that.
Right.
I'm picking your brain on things there. I just remembered you were part of the residency admissions committee at Georgetown.
Mm-hmm.
So you had a chance
Right.
to
My
go through
last year.
yeah,
Yeah.
you had a chance to go through applications, meet the residents. This COVID-19 pandemic has really shaken things up a bit.
Everything.
I think the AUPO and the SF match I was just reading are going to make it so that one, all interviews are virtual. Two, people can't have more than 20 interviews for the season. And three, they can only have like 1 a.m. and 1 p.m. I think if unless you don't have a department or of ophthalmology at your home institution, aways are being discouraged. And it's hard to predict how things
Yeah.
are going to happen.
It's shifting
When you
things
were
a lot.
looking at applications, what were some of the things that really stood out to you, especially in retrospect now that you've been on the other
Mhm.
side of things, that make a good resident in terms of trying to figure out who would be a good fit for your residency program or who would just be a good ophthalmologist in general?
Yeah. Well, there's the objective stuff and then there's the subjective stuff. I took a lot of time to read carefully the personal statements. There's the way I look at it. There's the 95 percentile where it's like, oh, this is just pretty general personal statement, and then there's like the 2.5 that have a personal statement that actually hurts them, and then there's 2.5 that have a personal statement that is really impressive. So those that I found that had a personal statement that was really impressive, I just sort of picked out and took a look at their applications even more carefully, particularly the people who didn't have the objective data to help them out and see how is this person like how are these person's life experiences going to make him a better candidate. And I can think of one specific example, which I'm obviously not going to name, where they had a really compelling personal statement. And when I met them at sort of borderline with the numbers, but then when I met the person in the interview, it was, we were all sort of blown away. And that person ended up matching very well, not at our program, but,
Right.
but very, very well. So yeah, I mean, I think that has a lot to do with who you are as a person and what you've experienced before in life. And then I guess just the objective data, whether you want it or not, it's there. It's there to filter some people out, unfortunately, or not.
Right. To me, that in-person experience is so crucial for gauging someone. I
Mhm.
mean, if you're applying to ophthalmology, chances are you have a pretty good application.
Mhm.
Part of it is people self-select themselves for ophthalmology. But that's what I'm wondering is what's going to happen when we lose the ability, like we are now, to sit down face to face. You
Mhm.
can really gauge someone in person. And yeah, it's easy to be fake or put on an air on interview
Mhm.
day, but you really get a better feel for what someone is like, what their energy is like, what their personality is like when you're sitting across from them. And now that we're going to have this physical barrier screen in front, we lose that part, that that really crucial part of the application process. So I'm wondering, are there going to be people who are phenomenal candidates, phenomenal people who do great things in ophthalmology, deliver great patient care, push our field forward, who maybe don't have as quite competitive scores or, number of publications X, Y, and Z, who are maybe going to be a little bit more biased against this process?
I mean that may happen, but if they're so great, like you're saying they could be, I think whether they join one residency program or another, eventually they're going to get there if they have the drive. So, will it be an issue for matching? Sure, it's going to make things different. Um, but at the end of the day, if you want to get somewhere, you'll find a way to get there.
I like that. I like that spirit. We talked about how you've kept up with reading, how you've kept up with surgical training, how you started a family and how you have kids. One thing we often talk about sometimes in between surgeries is working out and staying in shape. It's an important part of both of our lives.
It is.
How have you managed that, or what are some of the physical activities you love doing, and how you integrated that into your ophthalmic education and
Yeah.
training?
So when I was you know how they say freshman 15?
Yeah.
Well, I did freshman 45s. So I got in a good amount of weight in college, and I lost it all in third and fourth year of college. When one of my friends introduced me to P90X, so I started doing P90X to get back in shape. And then, but I haven't been doing it for like the past 3 years or 6 years or anything like that. And then just making sure that you work out at least 3 or 4 times a week. And the biggest change in the past 3 years was I started doing intermittent fasting. That has been probably the biggest change in terms of working out or fitness in general. So I do the 16 and 8. So I eat from 12 to 8, and then I fast from 8 to 12. And I drink black coffee in the morning, which makes it really hard for surgical days because you can't have a ton of coffee. and but I think the intermittent fasting was definitely a big game changer in terms of helping me maintain weight when I couldn't necessarily work out as much as I wanted to in some weeks more than others.
You and I are kind of on the same page on that. I kind of stumbled into intermittent fasting accidentally during third year of medical school. I think when I was on the general surgery rotation, because there was mornings I was getting up at 3:30 or 4 to go to the hospital to do pre-rounding.
Right.
And I just didn't have time. And and then after rounds, we would go straight to the OR. And so a lot of times there were some days I wasn't eating until like dinner. Dinner was my first meal. And I think I just, especially after intern year, just adapted to that a little bit. So I know people say breakfast is the most important part of the day, but usually I skip it. And honestly, I feel like I have more clarity. I feel like I'm firing on more cylinders. I think that's just maybe carbs. Like carbs sometimes slow me down a little bit. Or if maybe I didn't get as much sleep as I wanted to, I feel like not. I will kind of intentionally make sure I delay when I'm having my first amount of intake. But yeah, intermittent fasting I feel like has been a huge game changer. What specifically do you do when you work out? Is it just more cardio focused, or are you focusing more on weight training?
So I try to run at least twice a week, and then the other 2 times weight training. Most of the time I do 1 or 2 of the routine P90X routines. And then I'm subscribed to Beachbody on Demand. So I choose, kind of whatever weightlifting video looks appealing that day. And then just try and just get something done. Even if it's 25 minutes, 20 minutes, 30 minutes, just get the blood pumping and just making sure that it's part of your weekly routine. It's easy to let go, and, you got to take care of yourself.
Something is always better than nothing. And I think that is so true. Even days where I'm post call or super tired, or I just know, I always try to be mentally on top of my game when I'm heading into exercise, but there's some days when I just know my body's tired or my mind is tired. And I just know that doing something is better than nothing most of the time. And it's just accumulating those over a period of time that just improves health in the long term. It's so crazy to hear you talk about P90X because I haven't heard someone bring that up since I was back in undergrad. And I had a couple of really good friends who were super into that, and I did it with them for a little bit. And that's a heck of a workout. I mean, it's high intensity and I don't know, a fairly short amount of time. And I think people sometimes overestimate how much time they need to get the blood pumping, to get the heart rate up, to do something physical. It doesn't have to be. I mean, even when I do weight training, I don't go train for 3 hours in the gym. It's usually 45 minutes to an hour, maybe. If I, add a little bit of cardiovascular work on at the end. And so I've tried to be very, very cognizant of making sure I don't let that slip in residency, but I tend to work out in the evenings for whatever reason. That's just when I prefer it. And as I've gotten older, I think I used to have no problem working out at 8 or 9 p.m. and then falling asleep. And now it's like when I exercise now, I'm up for a lot longer.
That's why I work out in the morning, because otherwise I have trouble falling asleep if I work out late in the day.
Yeah. So I've had to kind of shift everything a little bit earlier and then try and make sure. I think sleep is the harder thing now in residency, is making sure you get plenty of sleep. You used to play tennis. Are you still doing that?
Yeah. Well, I haven't played in a while, but yes, I still do.
And you founded a couple golf tournaments. How does that happen?
So it was just sort of an idea that came up among friends when we were in New York. And And we were like, oh, it would be nice to, just have something to do every year and just get some friends together and make it an annual thing where like we pick a city that has very nice golf courses and we just fly there, play for a weekend and then come back.
So it's a thing amongst friends.
Mhm.
That's cool.
Yeah.
That's cool. And you've done that every year?
Yeah, well, since the twins were born, I haven't been able to go, and just sort of life happens. But the tournaments kept going on, so I think last year they had over 40 participants.
Nice.
So yeah, not huge, but not small, not a small group. I mean, it's hard to coordinate 40 people traveling to the same city, the hotels, the tee times. I mean, it's essentially taking up the whole golf course. Yeah.
The question I've been wanting to ask you the most is talk to me about your experience as an art dealer. I want to hear all about this.
Yeah, so my stepdad's an art dealer, and we just wanted to get involved in it when we were younger. It was a way for us to make extra money so that we can waste it away in whatever we were interested in at that time. But the part that I helped out the most was getting stuff in online auctions, because my stepdad, he's not very good with computers and stuff like that, and the internet. Now he is, but back then when I was younger, it wasn't as common as now. So it was finding the right auction for the right piece and getting it appraised, and then getting it insured, and then sending it there, and then hoping that it would sell. And it was really exciting. We had this, they would send us this catalog and you would see the piece that you sent and it was there and it had your name. And when the auction was going live, you were like, oh my God, please someone bid on it. And when it did, it was really exciting. And when it wasn't, well, it was not as fun, but no, it went well. Did it for a couple of years. So, like collection, wristwatches, just like table watches and then other antiques and stuff like that.
As I've gotten older, I've realized the ability to sell is so important. Like not even just in like the business sense but just even, in everyday life, talking to people, the ability to either.
It goes back to what we were saying about communication.
Exactly. 100%. Yeah. It goes back to communication. And then I wanted to ask you about, I had no idea, because I'm a huge tech nerd. I mean, you're surrounded right now. We're filming this. We got cameras, we got microphones. Right. Like I've ever since I was a young kid, I've always been into tech. That's one of the reasons that I love ophthalmology so much. Influenced maybe my decision a little bit to go more into the anterior segment side of things than the posterior segment side of things. But you spent some time as a software developer for the smartphone retina fundus
for the OMEN indirect. So yeah. I wasn't involved in the coding part. I was more involved in like the clinical aspect of what I would want it to have, because so that it would be more appealing for just doctors in general to use. So it was more the development of, I think we need to have the focus on the left side, or I think it should take 20 pictures in a second or whatever, 200 pictures in a second, as opposed to just recording, and it should save it to this or to that, and, helping set up the distance and saving the autofocus and just different things. And then having a tap for a different type of lens. So like if you were to use a 28 diopter lens, your focal distance is just different than with a 20 lens. So having that saved in the phone, that it would automatically adjust the camera settings and that sort of stuff. That's the part that I was involved in, not so much the coding and the software developing.
Gotcha. Because I was going to be like, this is a side of you I had absolutely no idea about. If you're like low-key, a
low-key coder.
Yeah, low-key coder, spending your nights up, on the computer coding things. You've been here for 4 years for residency. You did 2 years there for fellowship. You've been here 6 years, the better part of a decade. A lot has happened in Puerto Rico over that time.
A lot.
3 hurricanes, Maria, Irma, Dorian. What's that been like, seeing everything that's happened, where your family is back home and being here and kind of going back and forth?
It's actually been really frustrating being here. It makes you feel helpless. You see your friends, your family, people businesses just struggling, and it's obviously helpless. So part of the reason why we decided to go back is because, I wanted to be there for our people, so to speak. And, when you go back there, you don't really notice it as much as how the news portray it, because there's areas that are not doing as well as others. And there's definitely a lot, a lot of poverty and a lot of people that need help. But then at the same time, there's people that are doing well. And I think the idea of what people have of Puerto Rico when they see the news is not totally true to what the experience is for everyone that's there. So yeah, so there's a lot of everything, just like in every country. But I can't wait to go back and just be a part of things back home again.
Soon, man, you're going to be there soon. I was, what did I see? Just within the past week, I saw, this blew my mind. Apparently this is a common yearly phenomenon, but the dust and sand from the Sahara Desert on a different continent across the ocean.
I know.
It came, and I was looking at the photos of the places in Puerto Rico where there's just so much sand. I said, and now apparently it's come to the U.S., but is that something when you were younger that?
Yeah, we've it's always been an issue, but this year it was particularly bad.
Right.
I mean, I don't think I've ever seen either pictures or people talking about it, and I wasn't there to witness it. I just witnessed it from here, like you did. But my wife was there, and she was like, "Well, I'm glad we have to wear masks anyway, because I probably would have put on a mask, honestly, because it's so intense right now." So
That's wild to think about. I was on my mind because one of the grand rounds presentation I gave was on diffuse lamellar keratitis, DLK, which is like referred to as Sands of Sahara.
Right.
So anytime I see Sahara pop up, it's just like, on my computer, Google or whoever's spying, all these things regarding Sahara Desert pop up. And that came up the other day. And it was the first time in my life I've ever heard about that.
Right.
So you're heading back in 2 weeks, man. What are your hopes? What are your dreams now that you're done with training? What's on the horizon for you?
Well, I just hope, I can get started, hit the ground running and help people out and just be there for the people of Puerto Rico.
I'm thrilled that we were able to do this, sit down before you left. I'm super excited for what's to come for you, to see you kind of come into your own, hit the ground running. Honestly, like I said, at least in terms of my ophthalmic education, getting to know you, working with you, honestly has been a highlight. I sincerely mean that. So I wish nothing but the best for you. And thanks again for doing this, man. I really appreciate it.
I appreciate it a lot. It means a lot coming from you. And thanks for having me here in the Sell and Flare podcast.
Yeah, absolutely, man. Now you're heading back, but anytime you come back to visit, you always have a friend. You always have a place to stay with me.
Same thing goes for when you visit down there.
Will do, man. Thank you.